Okay, AP Psych class, welcome to our final video in Unit 13 on the treatment of psychological disorders. Let's look at the medical model. Okay, so the biggest thing associated with biomedical therapies would be drug therapies or drug treatment for psychological disorders. They're usually broken up into these major categories. Your antipsychotic drugs are going to, there's two different types, but in general, antipsychotics usually work to dampen the responsiveness to irrelevant stimuli, those positive symptoms of schizophrenia, for example, your hallucinations. We know are from an excessive amount of dopamine. And so the antipsychotic drugs like Thorazine, for example, would block that activity by occupying the receptor sites that are normally reserved for dopamine. One of the downsides to the antipsychotics is a side effect. It's called tardive dyskinesia, and that's like involuntary twitching and movements of the face that for some reason seem to happen as a result of too many antipsychotic drugs happening. Those negative symptoms of some of our mental health issues, like schizophrenia, could be helped with drugs like clozapine, and so the withdrawal or the sluggishness may be helped by drugs like that are actually going to work to stimulate nervous system activity overall, not necessarily with the dopamine, right? We don't want any hallucinations occurring, but just speeding up overall activity in the brain. If you recall from our unit on bio and behavior, we have amino acids like GABA and glutamate that act as neurotransmitters. And so glutamate acts as an excitatory neurotransmitter, exciting overall activity. Right? So the majority of the antipsychotics are going to work on suppressing or blocking dopamine receptor sites, but we do have some that would fall under this category that would work on just speeding up or stimulating the nervous system overall. All right, your anti-anxiety drugs are going to depress or slow down central nervous system activity. That anxiety is usually a result of too much nervous system activity. And so GABA is the amino acid that is the inhibitory neurotransmitter. And so it can act on those synapses to actually prevent the release of particular neurotransmitters into that synapse. And so by boosting the GABA, we don't have an overabundance of activity in the nervous system, which can decrease their anxious response to things like phobia or OCD or things of that nature. Your antidepressant drugs are going to work by increasing the availability of either norepinephrine or serotonin. Prozac is a really big antidepressant that works by blocking the reabsorption of serotonin, which they're referred to as SSRIs, or selective serotonin reuptake inhibitors. So again, some review from our unit on biology and behavior. That those antidepressants are going to let serotonin linger in the synapse longer so that it can be absorbed rather than reuptake occurring from that sending neuron. Some important things about antidepressants. There is a very famous Kirsch study that said that the placebo effect may be responsible for like up to 75% of successes concerning antidepressants. And the conclusions of the Kirsch study were that only the most severe cases of depression seem to benefit from drugs. Another example of a drug that's used oftentimes with depression, especially bipolar disorder, are mood stabilizers. The most common one being the use of the simple salt lithium as a mood stabilizer. And so when we think biomedical therapies, I know that we often think about those sorts of medicines or drug therapy, but there are other things that we can include. Okay, insulin coma therapy would be something that was commonly used in the 20th century, that it's not really used so much anymore, in that it's not localized, it's not specific to brain activity, and so it tends to be risky. What happens is that it would send an individual into insulin shock or into a seizure, but it seemed to get the same result as something that is more currently used now because it is localized. ECT, or electroconvulsive therapy. Severely depressed patients, again, severely depressed patients, seem to benefit from having a brief electrocurrent being sent through the brain. Now, of course, please know that they're anesthetized, that they're not feeling the pain. Since they're sleeping, about 82% of people said that ECT was no less traumatic or upsetting than a trip to the dentist office. And so the aim is to localize the seizure in the brain, which seems to kind of like shock it back into a more regulated electroactivity in the nervous system. It seems to put things back on a regular track. Oftentimes it looks very traumatic and horrible, and so sometimes it's been given a very bad rap just based on, it looks painful, but it seems to work really well for some severely depressed individuals. Okay. Some alternative therapies that are out and about. There seemed to be a chest implant that would electrically stimulate the vagus nerve, which goes directly to the limbic system in the brain. That seems to have worked sometimes concerning the regulation of mood disorders. We also have RTMS, right, which is repetitive transcranial magnetic stimulation. There's not a seizure, and there's way less side effects, but it's using magnets to kind of disrupt and then realign, functioning circuits in otherwise inactive areas of the brain, like the left frontal lobe. And so, since all neural communication is electrical, it's only logical that forces that affect electric currents can alter brain waves, and so magnets seem to kind of be a safer alternative to actual electrical currents. Okay. For severe last resort cases, we would use or employ psychosurgery, which would be removing or destroying specific areas of brain tissue. The most common, obviously not really used as a routine procedure these days, would be a lobotomy, which is cutting the nerves that connect the frontal lobe to the emotional control centers of the inner brain. Good news, the side effects of lots of mental health issues tend to be alleviated. Bad news, right? Frontal lobe not connected to rest of brain. And so that tends to leave some people in kind of this zombie-like or vegetative-like state, depending upon how much tissue is destroyed. Okay. One of the big things that is encouraged now is what's known as therapeutic lifestyle change. Kind of focusing on that mind-body interaction, right? Aerobic exercise, sleep, strong social and emotional ties, good nutrition. These sorts of things can aid the things that are listed above. And so, being on a drug therapy, your body will react much better to specific antipsychotics or anti-anxiety, antidepressant levels in the system when you have a well-regulated, healthy system for it to work on. Okay, so to end Unit 13, we can talk about prevention of mental health issues. Obviously, the lifestyle changes that we just discussed would be important, having those active coping skills to deal with stress. We've talked about this in Unit 12, right? Psychological resilience tends to play a role in avoiding things like we learned from the Seligman research on learned helplessness, right? If we can empower individuals to change their perception that they too can overcome mental health issues, it goes a long way in the prevention of serious cases of them. And so that concludes Unit 13. Bring any questions you have with you to class. Thanks for listening.